Hello, everyone. This is Dr. Brian Capra from Genesis Chiropractic Software and Billing Network. This is a really, really important segment here that we're recording for you. It's a topic that we just get tons and tons of questions about. Today, we're lucky to have Dr. Ray Foxworth on the line with us on the video. It's going to bring a lot of great content. Dr. Foxworth has been serving for over 12 years, was the first chiropractor ever appointed to the Mississippi State Board of Health. Dr. Foxworth has served on the Medicare Carrier Advisory Committee for over 25 years. In 2007, he founded ChiroHealthUSA. Many people out there listening today probably have heard of ChiroHealthUSA, also known as CHUSA, a nationwide chiropractic network that works in conjunction with a DMPO, helping doctors offer compliant, affordable care for their patients. He has practiced for over 30 years and maintains 2 successful chiropractic clinics. He's in the trenches on a daily basis and facing the same challenges with billing, coding, and compliance issues just like you and I. So, Dr. Ray, thank you so much for joining and giving this information to our network of docs that so badly need clarity on this topic. Maybe you could tell us a little bit about how CHUSA got started.
Sure, I'll be glad to, and I appreciate the opportunity to speak with your family members, and hopefully they ultimately become members of both families. So ChiroHealthUSA, I will be very honest with you to say confession is good for the soul, and I always tell the story of why it got started. And it wasn't because I woke up one day and decided, geez, I want to have a nationwide network and work with a discount medical plan. It happened because of my Miss Jones story. And Miss Jones was a patient I was taking care of, her and her husband and a couple of kids. And back in the day, I was charging probably $35 a visit. I'm happy, they're happy, everything's good in the world. About 3 months later, Miss Jones was involved in an auto accident. And so I did probably what everybody on this call does, and most everyone in the profession. I charged my normal fees, which were obviously a lot lower than or a lot higher than the fees of the $35 or so Miss Jones was paying. Mm-hmm. And about 2 weeks after that, Miss Jones comes in with some papers in her hand, and I walk in the room, and there she is with her husband and a couple of kids, and I always have a staff member in the room who's scribing for me. And I walk in, and it's like, geez, something is wrong here. And so I poked the bear and said, Miss Jones, you look like you're upset. I said, what's going on? She says, she literally walked across the room, taps me on the chest and says, Doc, I saw what you were charging to the insurance company, and I see what you charge me. It's docs like you who keep me and my family from being able to afford health insurance. Mm. And that was a kick in the gut. And I paused briefly because, quite frankly, is, geez, how do I explain this? And I said, no, Miss Jones, the reality is I never showed you or told you what our actual fees were. And so you just assumed that the $35 that I was charging was my fee. And really what I was doing was I was attempting to help you. But I did make a horrible mistake. I never let you know what our actual fees were. She said, well, I don't care about that. I reported you to the Attorney General. So it kind of rose to another level, and it made me, the good news is I didn't get any legal issues with our Attorney General. It helps when you're treating state employees. I'll leave that where it is. But the other thing is we didn't have a law in our state at that time that prevented us from charging a higher fee to insurance than you did to cash. It had never really been an issue. But the reality is, even if your state has a law that says that you can offer discounts, if you don't let your patients know what your actual fees are, and they see different fees charged to them when they're cash versus insurance, there's just no good way that comes across well for a patient. And so that's what prompted me to start looking at, geez, why is it okay for Blue Cross, Aetna, and Cigna to all pay me a different fee? That's perfectly fine. But yet I can't have a lower fee for my cash patients, for my Medicare patients for their non-covered services, for people who have limited visits like Blue Cross, 12 or 15 visits, for families. How are they able to do that and I can't? So I started doing some digging, and what I found was that there was this model out there called a DMPO. And if you don't do anything else, write down those 4 letters. That's your new acronym for the day. It is a discount medical plan organization. Most of these entities are owned by the insurance companies. So they are a regulated entity. And so I contacted a couple of them to see if we could have a working relationship. And the problem was, if I signed up with them, I had to agree to their reimbursement, and it was low. And if I joined their discount medical plan, then they could take my name, if you will, my contract, and subcontract it to other payers, which literally knocks the heck out of your best reimbursements. So I finally found a company called Alliance Health Card of Florida that was willing to work with us. And we literally wrote the contract, wrote the fee schedule, the structure of the fee schedule. And here we are 10 years later with nearly 5,000 doctors in our network. And to date, we've had over 650 something thousand patients that are part of the network. So this isn't something that might work, it's something that does work. And I know that doctors get a lot of conflicting information about fees and fee schedules and inducements and kickbacks and all this stuff. And quite frankly, most of us just want all that, pardon my French, crap to go away. We want to be able to get paid well if insurance is available, but have a mechanism in place for patients that do have limited benefits or no coverage at all. So the benefit of the discount medical plan is rather simple. It is regulated by the Department of Insurance. I'm literally considered a third-party administrator in the state of Illinois. And so my goal in this was to put together a plan that when we look at the rules and regs we have to follow, you got your board of examiners, your provider agreements, you got your Department of Insurance, your state attorney general, the federal attorney general, you've got the OIG, and you got Medicare. And it's like, what can we do to be able to offer discounts legally and compliantly? And that the best model that we found was the DMPO. So it was my worst day in practice, but as we sit here 10 years later, it turns out it was my best day in practice, because had that not happened to me, and had I not been looking for a way to fix that problem, we would not have the latitude that we do to set our fees like we're able to under the DMPO. Let me get a little sip of water here.
Yeah, that's an amazing story. I mean, and in chiropractic, you hear it so often too. I mean, even our story with Genesis, which I won't get into now, started usually with a patient and a problem. And so a credit to you for turning a situation that from I don't want to say tragedy, but into a triumph, you know. So thank you for seeing the opportunity that, and the problem that you had, and how you knew that that was probably affecting so many other patients and chiropractors, and be able to turn around to something that is really a huge benefit to our profession. So thank you so much for doing that.
You bet. And the way I was able to do this in part was also because our state health plan, 195,000 people, had great coverage for chiropractic, but when they moved to managed care, they wouldn't contract with a single chiropractor. And I literally set up a statewide network here, and we became the network for the state health plan through a bidding process. And so that's how I had the contacts in the insurance world. And it's like, geez, here's a model. That's what we're going to follow. I want to always run toward regulations rather than trying to figure out ways to run around them, because I feel like the safest place to be is in a regulated entity. That way, it is never questionable. You are simply offering a contractual network discount. So, docs, I want to kind of get into a few slides here, because I want you to understand the importance of having a fee system. In the chiropractic world, we've had our PI fee, workers' comp fee, cash fee, mother, father, sister, brother fee, Uncle Dudley, buy 10 visits, get 1 free fee. That's kind of the world we've lived in. And when you look at the medical world, they are a bit different. And I'm in a multidisciplinary spine center. My second practice is multidisciplinary. And so I've gained some insight into how they operate. And any entity or any hospital, any doctor's office should have one fee for each service that they provide. That doesn't mean that you always get paid that fee, but you should charge that fee unless you have someone that you've got a contractual network discount with. So let's take a look at this. Let me get my screen active. So for an average office, a patient may come in, get an exam, x-rays, an adjustment, and therapy, and your actual fees may be $350. For a routine visit, they may get an adjustment, some rehab, some therapy, and your total charges or your actual fee might be $185. So keep in mind, if that's billed out to Blue Cross or Aetna or Cigna, you're billing your actual fees. But if I am a member of Blue Cross Blue Shield and I've agreed to their fee schedule, instead of $350, they may only allow $220. That doesn't mean that my actual fee has changed. It just means that Blue Cross will only allow 220 of that 350. Same thing on a routine visit. I may bill 185, but under the contractual network discount, they're going to reimburse 95. Is that a dual fee schedule? Absolutely not. It's a contractual network discount. And then we have what's called regulated fees. So if you're seeing Medicare, Medicaid, and some states PI and workers' comp, they have a fee schedule. And it really doesn't matter that your initial visit is $350. They're going to pay according to the fee schedule. And in Medicare, obviously, we've only got three codes. You've got a participating and a non-participating amount that you can charge. And every practice can have a hardship fee schedule. Now, a hardship does not mean that every patient who's cash can get your hardship discount. And that's a pattern we've seen historically is, well, if they don't have good coverage, we'll give them a hardship discount, and now I'm charging them less. This is not my opinion. This is from the federal government. They say that even with Medicaid patients, you cannot categorically say that they are all under financial hardship. They expect you to document and prove that they are under financial hardship. So, and that's one of the things, one of the resources that we have available is how do you set up a hardship fee schedule? And just very shortly, you should only do it for a short period of time, A, because patient circumstances can change, and B, if you have them on hardship and then they go to work somewhere, it could turn out that they now have insurance. So you don't want it open-ended. Always, and it's very easy. You don't have to do a wallet biopsy and see their last 3-year tax returns. There's 2 or 3 steps that you do to make sure that they qualify for your hardship fee. We have a sample form of that we can share with your docs through your portal.
Very nice. And Doc, we have seen that actually happen in practice and with some of our clients that came to us after the fact, where they were giving a hardship to everybody, basically. And how does that typically happen? Is it a similar situation to Mrs. Jones, where somebody on a hardship somehow reports you to the board? How do people wind up getting in trouble with something like that?
That is a great question, and fortunately, I have a great answer for that. Do you know what the number one complaint to chiropractic boards of examiners is about? It is not about clinical care. It is about money. So when patients like Miss Jones, who, by the way, also called our board, you can save somebody from back surgery, but you let their bill be off by 50 cents and you go from hero to heathen, as the saying goes. So when you're doing hardships and you haven't documented it, if you were to get reported or audited, it really is a dual fee schedule, unless the person can truly say, I am having a financial hardship. I want the care. I need the care. I just can't afford, $75 3 times a week. So you also have people who have health insurance who may have high deductibles. And even though they may have insurance, you've got a copay or co-insurance that you're supposed to collect. But if that person truly meets financial hardship, it is not illegal to waive that deductible and copay. You cannot do that routinely. Let me make that very, very clear. But if they qualify for the financial hardship, you can absolutely bill their insurance, accept what insurance pays. What I would encourage every doctor to do, though, is at least charge the patient something. I don't care if they've got a $50 copay, have them pay $5, because I think it devalues chiropractic if there isn't some mechanism of equal exchange. And quite frankly, patients that get something for nothing are typically our headaches, the ones that don't follow through with care. And it's because, ironically, subconsciously, they feel out of balance with us. So I really think when you financial hardship, it's never, I'm going to waive your complete copay, but reduce it down to a number they can manage, just because of the dynamics around the perception of the value of what you do as a chiropractor. So when we talk about putting together your fee schedule, a lot of doctors struggle with that. In one of my other slide sets, I have a picture of a dartboard. And I think a lot of chiropractors just kind of use a dartboard and throw it and set on that fee. Or worse, they call their buddies around town to see what they're charging. Well, the problem with that is a violation of the Sherman Antitrust Act. It's called price fixing. If you and I, Brian, if there are 10 of us in the same town and we get together for lunch once a month and we say, hey, we're going to start charging this for exams and this for x-rays, we have committed an antitrust violation. Very, very serious violation of a federal law. And I can absolutely tell you that I know doctors and entities and associations that have been hammered for that. So what I want you to understand in establishing your fee schedule or your fees, you got to know your numbers. You need to know what your cost of doing business is. And we actually have a spreadsheet. It's an Excel format that you can plug in your numbers, your number of visits a year, the average reimbursements, what your overhead is, and it will calculate and show you what it costs you to deliver an adjustment, literally down to like $27. So when you're setting your fees, you don't want to set it at 20 if your costs are 27, because you can't make up the difference in volume. You know, buying oranges for a dime and selling them for a nickel. Yeah, buying oranges for a dime, selling them for a nickel. The strategy isn't get a bigger truck. You're just going to dig a deeper hole. So know your numbers. I encourage you to download that form at least. And this isn't a forensic exam of what your total costs are, but it'll give you a ballpark number. And I can tell you that according to Chiro Economics, their annual survey, average overhead in a practice is about 50%. But do know your numbers. That becomes important in a couple of different ways. Know what the market value should be, meaning are you the highest in your area, the lowest in your area? Again, you're not supposed to have those conversations, but I will tell you, I don't want to be the lowest. I don't have an issue with being the highest, because quite frankly, if workers' comp pays me $150 a visit, I want to charge $151 because I want to get paid that $150. But what we do as chiropractors sometimes we say, geez, my cash patients can't afford $150 a visit. And I know I need to be charging more than my overhead, so I'm going to put my fee at 50 or 75. The problem with that is every time you see a workers' comp case, you just left money on the table, and you cannot have your fee at 55, and just because workers' comp may allow 80, you can't inflate your fee to 80 just because they're comp. And that's the importance of having your actual fee be at or above whoever the best payer in your state is.
Okay? Absolutely. Glad you're saying all these things. And we are obviously at Genesis, we're always in a sticky situation with giving advice on coding and fee schedules and all that. We don't do it, but this is a great piece of advice to hear. Like just that, knowing that you can come down to other levels from the top the highest paying plan is the key.
You absolutely, and I will tell you this, that because we have access to doctors' fee schedules as part of our network, I always hear chiropractors complaining, we're not getting paid enough. Our reimbursements are going down. They're paying us less and less. And we actually did a study, if you will, of a group of clinics in Dallas, 10 of them. We looked at what their charges were, and then I went to the workers' comp website, and over 80% of them were not even charging what workers' comp allowed. Why would they do that? Because they don't know to go check the workers' comp fee schedule. Or if PI has a mandated fee schedule in your state, go look and see what that number is. And at least, I'm not going to tell any doctor what their fee should be. What I want to teach you is where you go look to find out what the fees are, so you can take that into consideration when you're setting your fees. Because
Right.
there is no reason for me to see a workers' comp patient for $80 when workers' comp thinks it's worth $120. Why should I be paid a dime less than what workers' comp thinks it's worth?
Right.
So our past struggle was the balancing act between what we charged insurance and what could a cash patient afford. And so we ended up skewing our reimbursements down because we were trying to take care of the cash population or the people with limited benefits in our office. With the DMPO, that goes completely away. You have the freedom now to set your actual fee, get paid that fee when insurance is available, because now you've got a mechanism and a legal alternative to be able to charge less to patients that perhaps couldn't afford that.
Very nice. So I'm sorry, I just want to be clear there, Doc. You as part of your service, you help doctors find for their specific area what their fee schedule.
What we cannot do is tell them what to charge. What we can do is steer them to resources that will tell you what the average reimbursements are in that area.
Gotcha.
And that resource, I'll be happy to share it with you. It is fairhealth.org. And there's a patient side and a provider side. And it literally lets you go down to the zip code, enter in a CPT code, and it will show you what the average reimbursement in network and out of network is.
Interesting.
You then go to the workers' comp. If you have a fee schedule in your state for workers' comp, you should go to the workers' comp website, and you typically are going to have to purchase this from a company called Ingenex, but it is worth the money because you will see what the maximum allowable is. If personal injury is regulated in the state, then you should be able to go to get that information from the Department of Insurance, and it's going to vary depending on what state you're in as to who has that info. That could be the insurance commissioner's office, or it could be some other entity that oversees that. But check and see if your state has mandated fee schedules for workers' comp or PI. Make sure that you're looking at that number along with what you're going to see on fairhealth.org. And that can help you, combined with knowing what your overhead is and what you want your profit margin to be. So we're not going to tell you what your number is or what everybody else is charging in your area, but we can walk you through, here's the mechanism to determine it. Does that make sense?
Gotcha. Yes, sir. Very good.
So when you look at using the discount medical plan, if you'll notice, we replaced Blue Cross Blue Shield's emblem with ChiroHealthUSA. When you join ChiroHealthUSA, we do not set your fees. That is one of the things that is unique about our network. Every doctor must offer a minimum of a 5% discount, but I will tell you that the average discount on a new patient visit is about 50%. The average discount on routine visits is about 30%. And that isn't, I'm not sharing information that I shouldn't be sharing, or I don't want you to use that number for your practice. That's published information that's out there. Typically, you call a doc's office and you say, how much is the first visit? And their first question is, well, will you be filing insurance versus, well, no, I'm a cash patient. Well, they automatically just give them their cash rate. And if you look at those same charges that they would have been billing out to workers' comp or PI, the ballpark is we're given about 50% discounts. So because we're nationwide, the cost of doing business in Mississippi compared to Tennessee, compared to New York, compared to California are entirely different. So we had to set the 5% minimum so I could represent to the insurance commissioners that every patient that joins this network gets at least a minimum of 5%. But the number is more around the 30 to 50, depending on whether it's a new patient visit or routine visit.
Gotcha.
You also have the option of setting a capped fee. And I will tell you, this is probably one of the best things that we ever did in our practice. There is nothing worse than a new patient coming into your office and, they've called your office and said, well, how much is the first visit? And you say, well, it depends on what the doctor, we know the script. Well, Ms. Jones, it depends on what the doctor finds necessary. I'll be happy to schedule for a complimentary consultation, and the doctor can go over with you at that time. Did you answer their question?
No.
No. And it's evasive. And because in our world, we have the workers' comp, the PI, the mother, father, sister, brother, the insurance fee, it's all over the board. So when you're using ChiroHealth and you have a capped fee of $150, here's how the conversation changes. How much is the first visit? Well, Ms. Jones, it does depend on what the doctor finds necessary, but it could also depend on what your insurance company requires. And you shut up and they'll say, well, I don't have health insurance. Not a problem. We see a lot of patients without insurance. A typical visit for a new patient may be in the range of about $350, unless you have one of those discount medical cards. Do you have one of those? And the typical response is, well, no, I don't. What is that? Well, we're part of a network called ChiroHealth. It's $49 a year for you to join. And if you join that network, your first visit will be no more than $150. Do you prefer morning or afternoon? What have I done when I do that? I've told them what they wanted to know. How much do I need to bring? I've placed value on the services because they know it's $350, and most people can do the math and you figure, geez, I can pay $350 or I can join a network for $49 and it's $150. That's a no-brainer. That's why there's 600,000 people in the network. The other thing is, you got to understand that doctor's office is one of the easiest things for auditors to do, or adjusters to cut your bill, is to call and pose as a patient. And they do it every day of the week. We have documentation of clinics that it triggers an audit when they call and say, how much is a massage? And they say, well, it's $75 if it's cash, it's $110 if it's insurance. If I'm an auditor, I can build a list of people to go visit with a few phone calls, because our staff haven't been taught the importance of being honest, upfront about what the fees are, because we haven't had a good way to address the concerns of the cash patient. So the capped fee is dynamite to use, or you can say you're entitled, if you decide just to do a flat 50% discount on the first visit, you could tell them, our typical visit is about $350 unless you're part of a network. If you join that, you'll get a 50% discount. So you have the latitude of either doing the 50, like in this case, the 20% or max of 150. The beauty of that is, let's say the patient has already been under chiropractic care. They didn't need all the x-rays. Let's say their charges only came up to $95. Then you give them 20% off the $95. But if they need the full workup, now you're not sitting there playing let's make a deal with the patient about whether they get x-rays or not, whether they get therapy or not, whether they do rehab or not. So you look at the routine visit and you have the same capability. I have a capped fee, and this isn't my number, but let's pretend it is. This is for teaching purposes only. This is not advice or guidance on what you should charge. But when we have a patient that comes in for treatment, they'll get a 20% discount with a cap of $65. So when I recommend therapy and rehab, guess what? The patient isn't concerned about what the cost is because they know worst case scenario it's going to be 65. But if I have a patient that's just coming in, maybe they got a tendonitis in the elbow, and I'm just going to run interferential or ultrasound, and that charge is $35, they're going to get a 20% discount off of it. But so what we're doing is we're limiting their exposure. And what this does for them, you think about the patient who has a $50 copay, and if their out-of-pocket expense when they have insurance is $50, and then when they exhaust their insurance, their cost is about $50, guess what they don't care about anymore? Mm-hmm. Whether they have insurance or not. So typically patients run out when the insurance runs out. And so when we make our treatment recommendations, I'll go through the actual conversation of this later, but I want you to understand the benefits of establishing a capped fee or that discount to where the patient, the thing they fear the most is, oh my gosh, what is this going to cost me and can I afford it? When you're able to cap it out or tell them what their maximum exposure is or maximum cost, that conversation changes completely. Now, Medicare, this is a big issue. I don't know if your team is aware of it or not, but a Dr. Brown in Iowa just got fined $80,000 by the OIG. Actually, his fine was originally a lot higher than that. They negotiated it down, and guess what it was for? He simply wasn't charging for muscle stem. He came under audit because he was one of the largest Medicare providers in the state, meaning he just saw more Medicare patients than anyone. And so you're kind of sticking out there. That doesn't mean you're doing anything wrong, but it means there's a higher likelihood that they're going to look at you. And when they looked at him, they couldn't find anything wrong. There was no mention about his documentation, about his treatment plan. All they found was he wasn't charging for therapy, and that is considered an inducement. And it is $10,000 fine per occurrence. So do the math. You see a patient 3 times a week for 4 weeks, that's 12 visits, and you're not charging for that therapy, that's a $120,000 fine on one patient alone. That's why you see these crazy amounts being demanded back from doctors. It has nothing to do with what they paid. It has to do with the penalty side for creating the inducement. So under ChiroHealth, you can specifically for Medicare, because those are exams, x-rays, and therapy are non-covered, you have the ability to set $10 per modality or $20 per procedure or a certain amount for re-x-rays or x-rays or re-exams. So we give you the most latitude that you'll probably find anywhere in being able to set up your fees. And I can tell you, talking to so many doctors who see Medicare, Medicare patients won't do therapy. Horse hockey. I will tell you that when you say, Ms. Jones, I'm sure you've been to a PT, you know that's $125 to $150 a visit. In our office, we offer low-tech rehab, and as a Medicare patient, if you're part of ChiroHealth, it's $10 a therapy. They don't hesitate because they know what therapy and rehab costs, and I don't guess about this number, 90+% of our Medicare patients absolutely participate in therapy and rehab. So for you doctors that are seeing Medicare and doing adjustments only, you plug this in and make it affordable, and you add on average $10 to $15 per visit for your Medicare patients. Go do the math and see how you just increase your revenue.
Yeah, beautiful. This is all great stuff. So, Doc, obviously we came together for a reason. Genesis and CHUSA. The biggest reason is, well, this is all great. I can see how you can keep track of this stuff, but how do you actually implement that, right? So I just want to take a moment to just let people know as you're going through all these points, having all these fee schedules set up in Genesis is really easy. It's as simple as when you're on the patient account, you just select CHUSA as your payer. Of course, in the back end, you've already set up all your fee schedules and discounts and all these things. We even have the cap fee. If it makes sense here, I'd like to ask you, one of the big questions we get all the time about this is actually patient statements. and what
Okay.
needs to be on the patient statement, what does not need to be on the patient statement, because the doctors, of course, get lots of information from all over the place. Do we actually need to show my actual new patient exam was broken down to $350 for the exam? They signed up as a CHUSA patient. That gave them a discount or a cap fee, however you want to word it. What do they need to see on their invoice? Do they just need to see their? Then you know the question. I'm sure you've heard it a million times, so you can probably do better justice than I can.
All right. So there are two options in it, and quite frankly, it is going to be 100% dependent on how the doctor wants to do that. There are some clinics that will show their actual fees and then have a line item that says contractual network discount, and they'll show what the patient actually paid. Some of the value in that is people are reminded of what the actual costs were and what they saved. There's been concern expressed by some doctors that, well, what if I just give them a receipt for what they paid and I didn't show the $350? There is no problem with that whatsoever. In my office, I have a Blue Cross profile, an Aetna, a Cigna, and a ChiroHealth. And in my office, even though my actual fee to Blue Cross might be $350 for a first visit, when I bill it out based on the Blue Cross Blue Shield fee schedule. I choose to do that personally because I don't want to skew my stats. If I'm billing $350, but I know they're only going to allow $220, yeah, I can show my write-offs, but it makes my collection ratio look horrible. So there is no issue at all if you load in what they actually allow and only bill that amount out. So let's say you're seeing let's say you're seeing a patient who might work at Blue Cross in claims processing, and they see what you're sending into Blue Cross, and let's say their cousin happens to go to your office and they're a cash patient and they see that it's a lower amount. Could that raise a red flag? Potentially, but here's the good news. I don't care if it raises a red flag, because if they come in and want to look at my books, I'm going to show them that, I don't inflate my fees. I bill according to the allowables, so I don't skew my accounts receivable. And as long as it is a contractual network discount, they're under the ChiroHealth profile, that's what allows you to give a patient a receipt for what they actually paid.
Okay. Well, I know you have some more information to go over here. I think this might be a good time to just let the Genesis users know that we've worked together quite extensively. So if you're interested, or maybe you're already using CHUSA, or maybe you're thinking about now becoming a member of CHUSA, we've actually built out all the training to help you understand how to implement this. So that means, how that actually implements day-to-day, how it actually works at the patient level, how the statements look, everything we just talked about. We have all the training materials ready and approved by CHUSA and Dr. Ray himself. Also, Dr. Ray's team is also able to help you on the other end implementing CHUSA as a Genesis client. So I just want to make sure you know that if you're watching this video, I'm going to put a link beneath the video to schedule time with someone from Genesis to take you through the training on our side. But of course, if you're not a CHUSA member, Dr. Ray is going to go through a little bit more information here. I'm sure let you know how you can reach out to CHUSA, become a member of CHUSA. So Dr. Ray, sorry.
Right. So just in short, the benefits of the discount medical plan is, unlike insurance and other networks, we don't dictate your fees. You get to set those. There is no cost whatsoever for the doctor to join ChiroHealthUSA. I know there's concern about joining networks of your contract being sold. I literally put in a clause in our contract that you have a 30-day opt-out period, because I didn't want doctors concerned about, ChiroHealth's got 5,000 doctors now. They're going to go contract with Allstate, and all the Allstate auto accident patients are going to get these lower fees. I do not have the ability to sign your contract away. If I ever lost my mind and did that, the network could literally go away in 30 days. So you're not locked into this. I want you to use it if it helps you. If it doesn't, or it's Like, again, anything that for whatever reason you're not bound to stick with the program. You got a 30-day opt out. So the critical piece in this is really training your team. What you want to do is to set your fees at the usual customary rates. Look at those resources that we talked about. The other thing you can do with ChiroHealth is you convert those shopper calls into new patients. We'll show you how to transition insurance patients to private pay once your benefits max out. I know that you deal with calls. They say, are you in the such and such network? No, we're not. Click. So I'm going to give you the conversation for how to handle that. So being out of network doesn't mean being out of luck. I know a lot of us want to see families, and there's really not a good legal way to have one fee for the first, for the mom, one for the dad, a couple of kids. There's a way within our system. It's an option. You can have a legal family plan where for each family member, it might be a little less than the person above them, if you will. We are all seeing $2,500, $5,000 deductibles, co-pays that are in the $50, $75 range. And quite frankly, a lot of our patients will never hit that deductible in our office if they have a high deductible plan. So I'm going to show you how to deal with that. I love this quote from Henry Ford. It says, the only thing worse than training your employees and having them leave is not training your employees and having them stay. And the reality is, if we look at just overall, just at personnel in any business, the people that are good at what they do are trained well, and they do, hopefully they do stick around, but they are also always looking for the next great deal. And I will tell you that the more you invest in your employees and having them well trained and keeping them happy, the better off you are. Just having staff that don't understand how to use Genesis, how to use ChiroHealthUSA, how to do whatever it is in your office, you've got to invest some time in training your people. And we literally have a training system that we go through one-on-one with your staff to make sure they know how to optimize the use of ChiroHealthUSA, because I will promise you it can help you build and grow your practice. I started this because of risk management and because of a threat, but what I found out over time is, wow, this is a great way to build my practice. So let me run through that. So I kind of already highlighted the shopper call. We can completely step away from being evasive and not giving patients answers by getting them to self-identify, which means if they say, hey, I've got Blue Cross, well, are you a state employee or a federal employee? And we typically, because the people in our area, we see the friends and family of them, we typically know what those fees are. So you can tell them, well, if you're a state employee, you have a $500 deductible, $50 copay. But when you have that shopper call that says, how much is the first visit? You don't have to do what we call the chiropractic two-step. You can go through the script that I gave you earlier. That script is on our website. It's in our training. It's in a video format, and it's about to be in a learning management system. So whenever you have a new hire, someone's going to be at front desk or insurance, it doesn't matter. They can get this on their own, and they also get it in print format. So if you want to tweak it a little bit in Microsoft Word, you can feel free to do so. But the key is to have that call scripted. Your established patients that have been getting discounts and now you're taking a step to be more compliant, there's a conversation I'm going to have with you a little bit later about how you transition those patients over. So on initial visits, when patients come in, let's say they're a walk-in, there's a way you can have a conversation with them. You tell them what the actual fee is, and if you get pushback, then you can, certainly if they can pay it, have them pay it. But if you get pushback, you can simply say, well, do you have one of those discount medical cards? So really what we end up teaching you is how to start having conversations with patients. For patients with limited benefits, if you have 15 visits, you recommend 30. What happens on the 16th visit? So the short piece of that is when you're going over your financial report of findings, Ms. Jones, the doctor's recommended 30 visits. You have 15 covered. On the 16th visit, our actual fees apply, and that's $95 a visit unless you have one of those discount medical cards. And again, all you're doing is opening up the conversation to tell them about ChiroHealth. Patients who have high deductibles, you can legally opt out of filing your health insurance based on a federal law, part of HIPAA under the high-tech section. I'm not going to get into the detail of this, but when you tell a patient that, with a high deductible, you're probably not going to meet it in our office. Some patients find it's more affordable if they use a discount medical plan. Do you have one of those? So again, all you're doing is teeing up the conversation. What I want to encourage every practice to do, the clinical report of findings is critical to us as doctors. The financial report of findings is critical for patients, because if they don't know what they're signing up for, that's a big reason we tend to lose a lot of patients. So high clarity on what their costs are, what happens when insurance runs out, keeps you from losing the patient or having to resell the case at the 15 once they've expired their 15 visits. So we want to show the need for care, have a treatment plan, and keep the care affordable. And the financial report of findings is critical in making sure that you have patients that are compliant. I've already told you how the family plans work. For those existing patients, it took me a long time to get my financial policy or a summary of it down to one page, but this is it. Now, you can have a more detailed policy about how you handle return checks and all that, but what we share with every patient is we blame, if they've been getting cash discounts before, but now they're going to have to join a network, we explain to them, I'm sure you've heard all the talking around healthcare and healthcare fraud and rules and regulations. Well, we still want to be able to give you a discount, and the best way we found is with a discount medical plan. And so you can read this for yourself. It basically says we've got one fee for each service provided. You may be entitled to a discount if I'm in your health plan, Blue Cross Aetna Cigna, state or federal program with a mandated fee schedule. That's Medicare, Medicaid, the DMPO, or if you do prompt payment, if that's permitted in your state, and the hardship policy. And it's one piece of paper, single-sided, summarizes everything. And you let the patients know that as of this date, this will be your financial policy. So that's how you convert them. If you want to take a next step with us and join several different routes in, you can go to ChiroHealthUSA.com. You can call us at 888-719-9990. If you do go to our website, go to the provider panel. And when you go into that panel, you can literally, I think, Christy, correct me if I'm wrong, but I think you can actually schedule an appointment on one of our team's calendars.
Very nice. Right. And I'll just say from my perspective and having Genesis clients that use CHUSA, we get nothing but great feedback about the program itself, but also the level of support that your company and support team gives back to them. So I want to thank you for all you've been doing so far. It seems like this is really an amazing system that you put together. It's really helping a lot of docs, and also, and of course, in turn, helping a lot of patients. Just to reiterate, if you already have CHUSA and you're a Genesis client, we're going to have a link below the video to click where you can schedule time to learn from the Genesis team how to really, with the fine details of how to get this thing implemented from the technology standpoint. If you are not a CHUSA user, obviously Dr. Ray just told you how to get in touch with them. So hopefully this is going to bring a lot of value. I think this is, I think you, Doc, you just put a lot of clarity around the whole concept of the discounts and all that. I know I've heard it before, but again, now I am much more clear on what this is all about and how to do it right. And I would feel comfortable, doing this right now in my practice. So thank you so much for coming and delivering this information. Is there anything you want to say before we get off?
No, I appreciate, like I said, the opportunity to speak with you, with your family, and we're here to help the doctors and support this profession. And if you ever have an issue, I don't mind giving you my direct email address. It's drfoxworth@gmail.com. So if any of you clinics ever do run into an issue, you can contact me directly, because I want us to maintain that level of service. We've got a great team here, and I'll be glad to help you when you're ready to take a step.
All right. Well, that wraps it up. Thank you so much again. And thank you, Genesis Nation. And hope to see you soon.